Health Education Lecture Series. All the listeners of Health Education Lecture Series, welcome to my show, Health Education Lecture Series. I am your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. And phone number 408 687 1899. We are discussing about the journey of life. When the life was started, what were the hurdles throughout its course that we are considering as diseases, and everything we have explained in all these lectures since many months. And step by step, everything was explained in three different languages: Angrezi, Hindi, Punjabi. And every day, this lecture is from 5 to 6 p.m. California Pacific Standard Time, one by one. And every day, different radio stations are joining with me to deliver these lectures. Some of them, they are cooperating with Hindi lectures. Some of them, they are joining me with Punjabi lectures, and some of them are with English lectures. I'm thankful to all of those who are joining time to time and expanding our family members, because they are spreading the lectures throughout the world wherever their listeners are. Wherever their listeners are, they listen all these lectures and on different days. But my lecture is every day and on different language. So today's lecture, because till now we have completed till now we have completed the life has reached up to the adult age, and after that the adult age I have described about this skeleton, this whole body structures, and how this body structure was formed, what are the components who are taking part for the composition of this skeleton, this the whole body: bones, muscles, nerves, blood vessels. And description of bones has been described. Description of uh, organs situated inside the body we will describe later. But at this time, we have completed the structures, how the bones are settled and how they form the different organs, different cages, just like the skull. Skull is formed by different bones, and I have described all the bones and their site, where they are and how they are united with each other. After that, we described about the neck and the bones of the neck, moving bones, fixed bones, just like the vertebral columns and all other descriptions. And after that, we have described about the shoulder girdle, and then after that, the pelvic girdle and the chest case as well. How this chest case were formed, how many ribs are there, and what are the types of ribs. We have divided into three parts: the original, true ribs, false ribs, and floating ribs. So I have given you the description about those ribs and then about their joints. Different joints of the body were described by, and different kinds of the joints, just like ball and socket joints, hinge joints, and all that joints were described, uh, where they are and what is the importance of being so, that why a joint is a ball and socket, why is joint is a hinge joint. So all these things were described time to time in due course in these lectures, and everything was described in Hindi, Angrezi, or Punjabi. All the three lectures. After that, describing the chest cage, I described about the abdomen and divided the abdomen into two portions, one the proper abdomen, and the other portion I described about the pelvic area. And the description of the pelvic area and pelvic girdle I described in detail regarding the bones, what bones are taking part in the pelvic brim for making the pelvic brim and pelvic girdle, and how they are adjusted with each other. And ultimately, what are the other helping bones which are helping to complete the pelvic brim? So ultimately, there are different organs. What's the importance of shoulder girdle? What's the importance of chest cage? What's the importance of a pelvic brim? And all those things. But their importance lies because they are covering the most important organs of our body, of our life. So we will explain all those things time to time, one by one. But first of all, we are trying to complete the structure. So, lastly, the last lecture was regarding the after the joints, we have described about the bones, characteristic of bones, what are the types of bones, what are the characteristics of bones, why they are of different kinds, and what is the importance, and what's their physiological role in this skeleton. So everything has been described step by step, step by step. And after that, we came across the skin, the outer covering of our body, which is very important and a big organ. Itself, it's a system. Itself is a system. I yesterday again described this thing, that the system means when it has a complete function which is carried out by this skin. Just like I describe you that the digestive system starts from the mouth and ends in the anus, and ultimately throughout its course is its channel and performs an important functions, and with the resultant that the new blood formation stuffs are squeezed from the food materials in the intestines and sent to the area where it can reach to the new blood formations. So everything has been described about this thing. And after that, we described the main functions of the skin other than this one. Okay, so because it's a complete system, and it takes part in the oxidation, it takes part in the maintaining the temperature of the body. It is a shelter to the whole body. It is the largest organ of the body, and it's the heaviest portion of the body as well. And it's a one-way traffic. One-way traffic I describe to the skin because directly, not water or air can enter into the body through the skin, but it's a sensory organs. It's a sensory organs, and the water and all these things can go out from the body to the environments. This is one-way traffic. And after that, I described about this thing, that it's a garbage collector, a big garbage collector of our body, where there is a collection of the garbage through the blood, when by all other means, by all excretion and secretions, the waste products of the bodies are not evacuated properly, and they are still mixed up into the blood and circulating into the system and the whole body system, then ultimately the portion of it every time, every minute is reaching to the skin, and every minute is coming back. So skin holds the maximum number of garbage, maximum quantity of the garbage, because it's the largest organ of the body and largest space it covers. And by uh, getting this big portion of the garbage, it has its own system of evacuations. And that own system of evacuations is com- composed of some of the glands, apocrine glands. And those apocrine glands helps this solid type of material which is coming into the mixed into the blood and is in a large portion which is not possible to be evacuated by the skin pores. And then these apocrine glands helps this garbage, uh, thick garbage in the blood which is coming to the skin, to chop them, and make them in small portions so that it can be dissolved into the blood water, and ultimately it may be evacuated by the shape of sweating from the different portions. From the every portion, you can say the sweatings comes out. So this way, it's also a garbage disposal and garbage evacuation system is carried out by the skin. So in performing temperature maintenance, protecting the body, and also releasing the garbage. And in this way, many other things we have added in this chapter when it was a detailed lecture about the skin, that why the skin has more importance as a outer coverings, not only as a outer covering, but it has more important functions which are carried out by the skin, secretion and excretions, and all these things are carried out. And ultimately, the one main important thing I told you about, that one, that till now we are considering that there are five senses. Those all five senses are recognized by the mind stuff, and mind decides whatever they are sending the information to me from the external world, whether it's true or not. To justify them, the brain is the only, the concentration point is the only one which can decide whether the information sent by the ear, sent by the nose, sent by the tongue, everything is true or not. So that's the mind. Or whether the information sent by the ear should be considered, should be taken care of, should be acknowledged or not. Because sometimes you might have seen that peoples are listening the things, ears are there, peoples are talking around, but you are busy in something special work, and you do not pay attention to what the peoples are talking, but their voices are also coming to the ears. And mind do not take recognition of all these things, because these things are not sent by the ear to the central mind portions. So in this way, there were all different type of senses, sense organs, and all these sense organs are having one lack, one deficiency, which the skin is not having. Skin, we can say, is more supermost, more important things for the sensations and feelings. And sensation and feelings, suppose if there is a cold outside and we are shivering, we feel that pain, mind cannot avoid this feeling. Oh, I do not recognize. Just like I just give you the examples that some people are talking in front of you or surrounding in your vicinity, but ultimately they are not reaching to the brain, and ear listens. It goes to the ear, but they are not sending to the mind, or mind is not recognizing those type of things, the voices, and even he do not remember. Mind do our dhyan, our the concentration, do not remember that, because it has not recognized it, recognized the things in this way. But remember, mind cannot avoid the sensations and feelings sent by the skin. Always, always, when you feel chill outwardly, mind cannot ignore this thing that I'm not feeling chill. Mind feels that. He cannot avoid that, just like the voices I told you. Just like you are tasting. One more example I can give you about this one, the importance of the skin, as I described. You are in a party, and you are in a party, and there are different kind of foods, a special type of food smelling very good, and ultimately this party was going on, and suddenly you hear a news that there is a fire on your house and everything's going to be burned. And now you are rushing towards your home, but the host requests you just to take to food, because you have to go away for long distance and you need food. So just eat food. But at that time, your tongue, which has to send the taste to the brain, that it's a less sunny foods, and it's good tasting foods and all that. What means this is the function of the tongue, that it sends the good taste to the brain, that it's smelling, or nose has already recognized it was a good smelling. But when you hear this type of news from the backside, ultimately ultimately your tongue will not send, though the food is going inside from the tongue will not send this message to the brain, or brain will not accept its message from the tongue, that the food is laziz, food is tasty, or nose sending the smell of the food to the brain, but brain will not recognize whether it is good smelling food or not good smelling food. Ultimately, mind is concentrated on the point that there is a fire in my house. And at that time, all these senses, what we have recognized till now, the five senses, all these senses, whatever they recognize, whatever they are doing, whatever they are feelings, either they do not send this information to the brain, or even if this is recognized by these senses, it is not recognized by the brain. Food was good or not, environment was hot or not, it was cold or not, whatever your eyes are seeing, whatever your ears are listening, whatever your tongue is tasting, whatever your nose is smelling, nothing goes to the mind, nothing goes to the concentration of dhyan or man, which indicates which indicates the things are same way, the food is same, or tunes of the you can say the songs and everything, they are nice, you are enjoying that one. But ultimately this connection is disconnected when you hear this bad news of your home on fire. After that, your mind is engaged in that news. Therefore, all other newses are cut off, coming from the different other type of senses. But remember, even if you are in this situation that your house is on fire, but if there is a cold, icy cold environment, you cannot go without warm clothing. You feel it. Who feel it? Body? No. Body send the indications to the brain. It is the brain who feels it's a cold. We need to take some blankets. We need to take some type of clothing, warm clothing for that one. Then to go out wherever we have to go out. So it means the skin is a powerful sensory organs as compared to the other organs. Their news mind can ignore. Mind can ignore. This food is smelling good. No, do not recognize. This food is tasting good. Mind do not recognize, because it is occupied by the news, bad news you heard about your home. But You cannot avoid when the skin sends the senses that it is too cold outside. You cannot go like that. It means skin is a type of sensitive organs, sensory organs, whose news cannot avoid your brain, about your mind. Mind has to recognize that. And even if there is a heat, suppose at that time your hand is close to the heat, or even then you are going passing near the heat, there is a fire in the jungle and you are passing from that one, does not mean even you have a bad news in your mind, then mind is concentrated with that one, but the skin is sending you the senses that there is a heat outside, temperature is too much outside. This sensation is sent from the skin to the brain, mind. So mind cannot avoid this sensation. It means the skin is the strongest sensory organs whose recommendation brain cannot avoid, mind cannot avoid, and he has to recognize all these things. And it's only possible if the nervous system is failed, if the nervous system is paralyzed to the skin. Otherwise, everything everything from all other sensations, all other sensitive organs may be avoided, but outwardly, outwardly expressions which are related to the skin cannot be avoided. So this is the importance of the skin. Yesterday I described in my Hindi lecture. So after that, we are at the junction that this body is complete now. We will go one by one for these different systems and organs, their formations, and ultimately their functions in the body, why they are is situated inside the body in a particular place, and what they do. And also, if they fall sick, what will happen to the body. But before going to that chapter, I am describing to you in general. It's a very important lecture at this time for all of you, for all the persons who are listening this lecture. It's a very important thing for all the listeners that on the first sight, when you see a sick person, when you go to see a friend, and you see something on his skin, on his face, on his eye, on his nail, many things, a doctor recognizes. And same way, I'm telling you those important indications of the outside, so that you can recognize ultimately later on that this person is suffering from this kind of conditions. You can say the outwardly expressions of the internally situated systems, internally arranged systems to carry on the life. Their expression, if they are healthy, definitely we have outwardly expressions. If they fall sick, because it does not mean that at the same time every organ will be having the same type of problems, every organ will be having the same extent of the disease whatever they are suffering from. No, there will be a range of a percentage, suppose if circulatory system is affected, the lung system will show something later symptoms, or the abdominal organs will show it later on, importantly. So in this way, the outwardly expression depends upon the internal changes inside the body. And inside the body, we know there are 9 systems. And we know that there are every system has a different organs. So your outwardly expression indicates that what organ is damaged, what organ is sick, so that you can, at the first instance, as the first visit, as the first, when you see a person, you're friendly, when you go to see him, you can recognize that he is suffering from this kind of problem, or what type of organs may be damaged or not function properly inside the body. These are the first and foremost thing you can recognize by looking on his face, on eyes, on skin, and everything. So this is an important lecture today. I am discussing with you external changes because of some internal changes inside the body, because of some diseases, because of some abnormalities in the system or in the organs. So it depends upon. These are known as basically clinical manifestations. For doctors, we say it clinical manifestations. In a vague term, we can say this is the window. It's a window, indication of symptoms outwardly is a window to see the inside organs. And this is the type of the things we known as clinical manifestations. Clinical manifestations of internally damaged organ or the system means the disease. And this is normally represented by the immune system of the body. The purpose of the immune system is to protect this body, to protect this life, so that life should run in a normal way. Whatever the norms are of a normal running of this body, that should run. We have a standard, a medical standard of health. We have a clinical manifestations which indicates the normal everything inside the body. But if ever there all these changes which we recognize outwardly are the health manifestations, if those changes are changing, if those changes are not stand still, then it is all because of our immune system is weak. Immune system is weak. That is why something is happening. The first thing you should recognize it. And these symptoms are, again, I can repeat it, these symptoms are, or the changes we see in front of the body are because of the internal changes in the systems or response to that. Example I can give you. Suppose if something goes in our eyes, immediately our finger goes through the nose. If something goes in our eyes, immediately our hand or fist will go to the eyes to rub that one, to get it out from that one. Maybe that internally, maybe from externally. When there is the eyes environment is not normal, immediately our hand goes to that one. So these are the some clinical manifestations you will manifest, but these changes are because of the internal diseases plus the immune system changes, that our immune system is becoming weak as compared to the diseases, and it's fighting to overcome the conditions produced by the disease, and but it's a weak as compared to the disease. That is why it's showing himself, representing himself in the term of change in normal behavior, change in normal condition. And change in normal behavior or conditions indicates that outwardly changes are the representations of the internal changes inside the body. And this may happen. All these things may happen because of hormonal imbalance. You know that hormones are a particular type of secretions inside the body and which are responsible for accelerating the function of various organs inside the body. Pituitary hormone. It is responsible for the production of testosterone in the testes. It's responsible for the ovary to produce the ovarian different hormones. We have many times described all these in estrogen and other hormones, LH hormones, and all those. So this is responsible for that one. And when all these things happens, these functions are not going normally. It means the hormonal imbalance is there. The hormones are not acting normally, and these hormones are not acting normally means something is wrong inside that. And what type of hormone is not working normally? That indicates a particular type of organ is damaged. Just like if pituitary hormone is not produced normally from the brain, and we know the function of pituitary glands, how it affects the constriction and relaxation of the body. It affects the constriction in the testis, constriction in the uterus, constriction in the various organs inside the body. It helps in that one. But if those functions are not going on normal, it means the pituitary gland is not working normally. It means whatever has happened, the pituitary gland is showing its effect. And from that, we can understand that the pituitary hormone is not normal. The same way, the other hormones, just like the thyroid hormone, everybody knows about hypothyroidism and hyperthyroidism. People are becoming flabby body, or people are becoming lean and thin. All these things depends upon the metabolic rate of the body, and that metabolic rate of the body, it depends upon the thyroid hormone, which is also T3, T4, which is also stimulated by the pituitary glands. So, in this way, it can indicate us if a person is becoming flabby body. Even he said, "No, I'm not taking that much food. I'm taking just a small quantity of food." Even then, my body is a flabby body and heavy body, and weight is gaining. It means something is wrong in the system. And if a person even eating uh, time and again, not three times, three meals, he may take it four, five, six times a meal, but ultimately still he is lean and thin. It indicates when you inquire about his history of eating and everything, and hunger, appetite, everything, and we find that he is eating well, but even then he is slimming and losing weight. So it indicates that some type of hormones are imbalanced inside the body. And which hormone? We know that it is thyroid hormones. And in this way, many of the things are changing outwardly. Thyroid hormone is produced inside, pituitary hormone is produced inside the organs, but their deficiencies or their excess of productions, whatever they are doing, indicated by outwardly expressions of the body. Body is becoming heavy body, it indicates the thyroid problems. Body becomes lean and thin, it indicates by the thyroid hormones and different type of activity, whether it is hypo, whether it's a hyper. If it's a hyper, the person will become lean and thin. If it's a hypo, the person will become flabby. So all these things we will describe time to time, everything in detail, that what will happen if the thyroid hormones are not working normal. But here I can just give you the examples that if internal changes are occurring, what may be the reason? We are describing these hormones, immunity, and all these things. But what may be the reasons how outwardly this body is expressing that, how we see this body? And whatever we see on this body, in the first instance, we will see, oh, person is very heavy, flabby bodies. We can inquire him, yeah, how much you eat? Oh, he said, no, 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 no. Oh, I just eat one or two chapati in the morning, one or two chapati in the evening, not much. But even then, he is becoming flabby body. So immediately it comes to our mind that something's wrong inside the body. And I am giving awareness by these lectures that if you see this kind of persons and this kind of his language, that I'm not eating much. If he's eating much, that's okay. If if he's a lazy person eating much, eating fat food, this and that, uh, he may become flabby. But if he's flabby but not eating much, it means something is wrong inside his body. Or on the contrary, if a person is eating every time he's continuing eating, but even then he's slimming down. And ultimately, we can come across the reasons that there is something wrong inside the body. But as a doctor, or we know that it is all because of the thyroid hormone is not normal. And if the thyroid hormone is not normal, we have to pinpoint this thing. It is just the first indication of the internal changes inside the body are expressed outwardly without going to lab, without testing anything, without touching the body. You know that this person is having thyroid problem, and later on you can recognize that he is having this kind of thyroid problems. In this way, the hormone imbalance may be indicating the outwardly expressions. And then accumulation of waste products, I will just described in the skin. Accumulation of waste product. You know, if we cannot dispose of our daily garbage from the homes, at that time, at that time, there will be a big smell in our house. And also, there will be dirt, there will be garbage all around our home. Okay, we can see kacharas, garbage everywhere spreading because we have not disposed it of. So that is the accumulation of waste product. In this way, all the systems inside the body, all the organs inside the body, they are producing garbage. And nature has its process to dispose of that garbage, channelize the systems of excretions. And if that excretion has been blocked by somehow, there are ways: stool, urine, sweating, breathing. All these things are the ways of disposing of the garbage of the body. But if there is a still garbage inside the body, it indicates that either the disposing of garbage, way of disposing of this garbage are blocked somewhere, maybe partially blocked, maybe one blocked, maybe all blocks, but maybe partially blocked. So if ever the disposing of garbage from the inside of the body is defective, is restricted, all the garbage is not removed from the body, in that way it will indicate something inside outside. Then we can see that yes, there is a something. Now I will tell you everything one by one. If the garbage is restricted inside, what will happen, what you can see outside the body. Hindrance in the functioning of the organs. If any organ, suppose heart, suppose lungs, suppose kidney, if any organ inside the body is not working, then it sends signal outside. to indicate that I'm not okay. I'm not okay. I need help. Just like we go to the roof of the house and cry that there is a fire in my house, there is fire in my house, come and help me. In this way, all the internal organs, singularly, alone, or in joint, when any organ is not working properly, then it sends signal outside that I'm not okay. Help me. And these are the changes I'm going to tell you today. These are the changes that when you see a face of a person, when you just go to see him, somebody told you that person so and so is sick. Okay, he's your friend or relative, whatever. You go to see him. You go to see him, and just you see his face, you see his hands. What else? Whatever you can see his, that will indicate you, just like the person will speak by mouth. Oh yeah, I'm not feeling appetite. I cannot sleep. Oh, I feel pain, this and that, restlessness. All these things will indicate outwardly. He may speak, he may not speak. But I am talking about today for those symptoms which he do not speak. And even then, you come to know that he is suffering from this kind of disease. So that's an important lecture. You must recognize this one. And even if today in English somebody cannot understand all these things, they should listen my next day's lecture. It will be in Punjabi, so that, and please keep pen and paper handy. Keep pen and paper handy, and whenever I mark all these things specifically, that this change is indicative of this thing. This change is indicating the that organ is damaged inside the body. This change outwardly will indicate that damage of that organs of the or the function of the system, whatever. So you can mark it on your paper that seeing outwardly a patient, seeing outwardly a sick person, you can recognize that he is having this kind of problems. And what type of system or organ inside his body is not working normally. So then directly you can go to that department of the hospital, that directly you can go there and tell the doctor, and then it will be more easy to get the treatment. Also in this way, so all these changes, so I have described you that if there are internal changes, these are depending upon the changes of our immune system. First thing, if a person is sick, the first thing, that his immune system is not working. Immune system is that he will make sure that everything of body is going normally, and you are a normal person. You do not feel any pain, you do not have any problem in go day to day life. It means you are normal. It means that your immune system is normal. But if anything you see on his face, you see on his skin outwardly, and which is not normal, then you can recognize that his immune system is not working normally. You know, when you go to the doctor, ultimately after giving the medicines, doctor tell you, okay, you have to eat this and that. You have to take this tonic just to boost up the immune system so that you can protect from yourself from the diseases outwardly. So in this way, the first thing I told you about this one, that whenever a person falls sick, it indicates that his immune system is weak. He cannot fight with the environment. He cannot fight with the whatever you eat. But he cannot fight with the whatever you eat, whatever you are doing, and whatever, suppose if you are night watching, you are not sleeping, you are overworking, ultimately your system will show up. It means your immune system is not up to the mark to bear this negligency that you are overworking, yeah, that you are night watching, or you are hard working, you are working more than normal hours, and you are working regularly more than normal excess hours. It will put some pressure on your immunity, and ultimately immunity will say hands are up. So it will be indicated outwardly on your face expressions, on your hand, on your skin, and everything. So, first thing, when you see a person is not looking normal, it means the immune system is weak. And second thing, I told you about the hormones, because hormones are just like fire. If there is no fire, then you cannot cook food, you cannot do anything. So, hormones in our bodies are to ignite the systems, the organs, so that they can work properly. If there is no pituitary hormone, all other systems which are depending on the pituitary hormones will not work. So it means if a person falls sick, one or the other, one or the multiple hormones are not normal in his body. First of all, immunity. Second thing, hormones of his body are not working normally, are not produced normally, so that they can excite a particular type of organ. Just like I told you, the pituitary gland hormone is stimulating the testes to produce the testosterone. It is stimulating the ovary in females to produce the ovum by various other organs. So it means all these things are depending on the hormones as well. That hormones are not normal. That is why he is not feeling well. He is sick. Whenever a person is sick, first thing, the immune system is weak. Second thing is the hormones are not properly generated, and they are not helping the other organs to do their normal work. And after that, I told you about the accumulation of garbage, because garbage should be removed. Suppose if you if 1 day or 2 day or 3 days you do not go to motion, what will happen? You are constipated with distended abdomen, pain abdomen. Not only pain abdomen, mentally you will be disturbed, and there will be various things. If you cannot urinate for 2 3 hours or 4 hours, and even the whole day, if you do not urinate, what will happen? You can well imagine. So, what is urination? Urination is a garbage. Stool is a garbage. If some way your sweat is suppressed, being heated, sometimes you are working in the heat and you immediately come inside and open your refrigerator and take a cold water. Ultimately, some people fall sick. Or sometimes after coming from the heat, you are sweating very much, and ultimately you go to shower and take a cold shower, and next day you fall sick. And next day you fall sick because the skin pores are constricted, and the garbage which was supposed to come from the skin pores is not coming out. It means your garbage was blocked. Stool was blocked, or urination was blocked, or the sweat was blocked. All these things, either any of one is blocked, will create problem that is known as disease. So if ever you ask the persons, do you go to motion today? He said, no, 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 no. Since 2 days I could not go to. If you ask the persons, oh, do you urinate frequently? How many times you go? Just like I told you, the normal urination for a person is from 6 to 8 times maximum. And out of 8 times, 2 times at the night and 6 times in the day, depending upon what you eat. If you have more liquids drinking every day, then there will be more pee, more urination, more frequent urination you can go to. But if there is a summer, you can recognize that if this is summer, even if you take more water, more liquid, more cold things, but even then you do not pee more in summer because most of the things are evacuated by the sweating. So, in this way, when the garbage of any kind is blocked inside the body, that also is indicating outwardly, and you will recognize that this person is a sick. And what type of changes it will bring up, I'm just telling you in this lecture or next lecture, that what will happen if what type of garbage is blocked inside the body. First of all, I told you the first thing is the immune system. Second thing, I told you about the hormones. And the hormones, what type of hormone is defective, what type of sign indication will be outside, just like thyroid, pituitary, all these I told you, and many things I will explain later on. And the third thing I told you about the garbage, garbage disposals. The garbage, the waste product of the body is not going outside, and they are causing hindrance to the normal function of the body, and they are expressed outwardly on the body, so that you can recognize, seeing outside the body, that this person is having this kind of problem. He's having immune system weak, he's having hormonal problem in his body, or he's having constipation or urination or sweating problems. These are the way of excluding the garbage from the body. So, in this way, these are the important tools, these are the important points you have to see when you see your relative, your friend, or as a doctor to see a patient. Every person has to recognize these three, four things, that the internal changes are because of what? Immune system, hormone system, or garbage excretion problem systems, or any function. What type of a function has been damaged? Then you can recognize that this kind of problem this person is having. Now, the next thing, common changes. When a person falls sick, there are some common changes, just like the skin. Skin becomes changed when there is internal problem, any type of problems. The skin is indicative, just like few examples I can give you today, and after that, day by day, whatever comes in my mind, I will time to time explain all these things. Just like a person is having yellow skin, everybody knows about that. Oh, he's having a pilia, jaundice. He's having jaundice. Has it? But not only one symptom will indicate, because yellow skin may be from different other conditions. I will explain later on. But first thing, first in your mind comes when a person is having jaundice, he is having yellow skin. So if you see a person is having yellow skin, yellow eyes, if he look at you and he has yellow eyes, then from the outward expressions you can say that he's having pedia, he's having jaundice. Jaundice indicative of what? It is indicative of that liver function is not normal. His liver function is not normal, maybe temporarily, maybe permanently failure. It's going to be failures, whatever it is. So the skin, first sign of changing color of the skin, becoming normal. Maybe a black person, maybe a white person, maybe or a wheat color persons, just like that one. But when the skin indicates yellowness, it indicates somewhere inside liver is not working normally. Everybody knows that one. And suppose the skin is cyanosed. Cyanosed means it's just like sky color. Normal, the skin having normal circulation of blood is little bit reddish, whitish reddish color or pinkish color, you can say that. But if it is cyanosed, this is indicative of something wrong. And not only the cyanosis, just like somebody is falling sick, has pneumonia or many other things, you see his nose, it's just like lack of oxygen, it indicates it's blue and cold. That's known as blue, or the sky color, tip of the nose. And also, not only this one, even the nail beds are also looking the cyanos. You see that the if you see everybody can see their nails, they are reddish color, or somebody may be having pinkish colors. But and when you see, they are becoming like sky colors, they are changing in color, then it is indicates that the oxygen is not going properly. That indicates who maintain the oxygen, who maintain the oxygen inside the body. There are two organs who maintain the oxygen inside the body. One is heart, the other is lungs. Lungs supply the oxygen, heart transport the oxygen. It means it means when you see the nose tip is blue, lips blue, nails becoming blue, bed nail, this is known as bed nail, it's becoming blue. And all this will indicate that somehow his heart and lungs are not working. One thing, keep in mind, I'm not talking about the temporary things. If a person is coming from cold, very cold environment outside, and he comes inside, and at that time, if you see that, his nose will be cold and blue, lips will be blue because he is coming from the cold, nails may be cold. That's known as washer movement center. But ultimately, after some time, without taking any medications, everything comes to normal. It means it means because of the outwardly environment, the function of the heart or the lungs was suppressed. But there is not anything organically damaged in the lungs or in the heart. They are normal working, but their function was hindered. Their function was blocked temporarily because of the outwardly cold seasons, cold environments. So, in this way, if any person, even without going in cold, even lying in bed and there is a good environment and a room temperature, everything is okay. But even then, if he is having blue nose, blue tips of the fingers, blue lips, and that's known as cyanosed. Okay, then ultimately you can say that this person is having somehow problem in his heart and problem in his lungs. In this way, there are many more other changes I will explain you, because I see the watch. The wall clock says that your time is over, because it's not going to be finished in it, even in 1 or 2 hours. It will take long time. I have to explain everything one by one so that you can understand what I want to convey you, that whenever you go to see any friend, any person, any relatives, and he is sick, and ultimately seeing outwardly, you can judge many of the things before going to doctor, that he is suffering from this kind of problems. So today's time is over. I'm your host Gurdeep Singh Sandhu, homeopathic consultant. My phone number is 408 687 1899. Anytime, if you are suffering from any disease at any time and you want to take second opinion about your disease, you can call me at 408 687 1899. Or even if you want to take a proper homeopathic treatment for that, for your disease, even then you can talk and consult me about your disease, and at 408 687 1899. If you are far away and you cannot talk to me on phone, you can send me an email, or you can say the WhatsApp message at 408 687 1899. And the email address is homeo medicine, HOMEOMEDICINE @yahoo.com. So anytime you want to consult me for any disease, or if even if you want to know about your continued treatment from anywhere, whether the treatment is going on in normal directions or not, I can guide you. It's not necessary that you can take treatment from me. You can take treatment from anywhere, but even then, I am your guide. Doctors are not only to treat, to take money. Doctors are also the guide of the society too. Our responsibility is to guide to the society so that they should remain healthy. And if they fall sick, they should get a proper treatment for that one. So, according to nature's process, I can guide you whether your treatment is going on the normal lines or not. So, anytime, if you have any question about your health, you can call me 408 687 1899. God bless you all. We'll see you tomorrow in Punjabi lecture, that what happens when a person falls sick internally, any organ is damaged or is not function normally, what it expresses outwardly, so that you can recognize it. Sat Sri Akal, Adab, Namaskar.